And thank you, Chris, for inviting me to be here and for sharing your story. That is so brave and courageous and such an important thing to share with everyone to make more people feel less ashamed. I'm Amy Everitt. I am currently the president of Golden State Opportunity. It is an anti-poverty organization based in California that works to create financial security for low-income workers. But before I took this job almost 5 years ago, I spent about 17 years running NARAL Pro-Choice California and eventually becoming the vice president for special projects at NARAL Pro-Choice America, now Reproductive Freedom for All. Prior to that, I'm a lifelong San Mateo resident. I am raising my kids here. I was raised here. I went to Aragon. And it's really wonderful to be here. I know my mother came here a long, long time ago and found a lot of solace. So one of the things that I was thinking about as I was preparing some remarks for today, and they kind of go right along with what Reverend Page was saying. She calls it choice, I call it agency. That we all have agency over our lives, and sometimes we don't know we have that agency, and sometimes we want to take somebody's agency away. I often think about my kids when they come downstairs and it's 50 degrees out and rainy and windy and they have a t-shirt and shorts on, and I think maybe you should wear a jacket. But it shows up in all sorts of different ways. And you'll hear me talk about how that intersects with reproductive rights and justice and economic security. I was asked to talk a little bit about how we in the most pro-choice state in the country, we absolutely are. We've passed so many laws over so many years and a lot in the last 2 or 3. But why we can't rest on those laurels. Why it is so important to continue to be ever present. Many of you, I'm looking at this room and I'm thinking, you probably were around for the first fight in 1973, and here you are again. So thank you for staying in the movement. Let me tell you a story about why it's so important. I had just gotten to Washington, D.C. in the NARAL offices, and I was sitting down doing my work, and it was April of 2007, and so when we got word that the Supreme Court had upheld the partial birth abortion ban. We all know there's no such thing as partial birth abortion, not a medical one, but definitely a political one. And I got up, we had our playbook, we were ready, and then I had this moment of total terror, like I had never felt before. It was so powerful, it like knocked me back down into my chair, because I was 4 months pregnant. And after I got back from Washington, I was gonna have my first amniocentesis because I was a geriatric pregnancy. And it just, the depth of that decision, which was a federal decision. So even in California, my doctors, if I got results that made me wanna make other decisions than continuing the pregnancy, all of a sudden, a medically necessary, medically safe procedure that was in my doctor's toolbox was, for no other reason other than politics, now illegal. They took away my agency to have the safest termination if I chose that route. It took the toolbox, it emptied the toolbox of my doctor and took away their agency to provide the care they knew they needed to. So when the federal government passes laws and the Supreme Court upholds them, there's no state law that trumps it. We are all in the same boat. And it's not just laws that matter, that are happening outside of California. There are attitudes, these attitudes that invade our very pro-choice state. And I'm gonna tell you the story about Adora Perez, who was in Kings County, and she was pregnant, and she went to Adventist Health Hanford Hospital. And when she was in delivery, she had a miscarriage and had a stillborn. This was traumatic. It was even more traumatic when the healthcare providers who were supposed to be helping her reported her to the police. Because while there was a lot of reasons for that miscarriage, they focused on one. And that was the presence of methamphetamines in her baby's, traces of it in her baby's brain and liver. Nobody thought that that was the reason that the miscarriage happened. She was poor, and she was a recovering drug addict. And when she found out she was pregnant, she got clean. she had a terrible public defendant. She pleaded guilty to what was called manslaughter of a fetus. That's not even a law in California. And she got an 11-year sentence. A few years later in 2019, Chelsea Becker also went to Adventist Health Hanford Hospital to deliver her child, who was also born stillborn. She also was a recovery drug addict. She had been homeless. She was poor. And they reported her to the police. She was also found guilty, but at this point the ACLU found out about the case and intervened. She spent 1 year in jail before the case was tossed out in 2022. At that point, a New York Times reporter found out about Adora Perez, and the ACLU got her released after 4 years in jail. So we have 2 women, and there are many more, who served time in jail because they had a miscarriage or a stillborn birth, because the attitudes of the people at this hospital and the attitudes of the district attorney and the police said, we have agency over you. You were not a good person, and we're going to put you in jail because of it. They took away all of their agency for years. So I think some of the important things to know about those 2 women, one was white, one was Hispanic, both were poor. Because the relationship between economic security and reproductive freedom is vice versa. You cannot have one without the other. I'll give you a few statistics in Kings County. 17.8% of all kids there live in poverty. Both Adora and Chelsea grew up in poverty. 16.4% of the total population lived in poverty. And when you're poor, you don't have a lot of agency. You don't have a lot of choices. A lot of those choices are made for you by policy, by district attorneys, by police officers. In America, so I should also tell you that when I left NARAL, or Reproductive Freedom for All, a job I loved, it was because I had seen so many instances like this. I had seen so many stories where policies were made, taking away the agency of poor women. And I thought, if those women had more money, they would be able to make better decisions, or the decisions that they wanted to make for themselves. And then oftentimes for both Adora and Chelsea, that meant having their child. So here are some other statistics, and I promise not to bore you too much with stats. But in America, 38 million people live in poverty. 56%, about 21.4 million, are women. And 25% of single moms live below the poverty line. In America, the poverty line is defined as $13,000, roughly $600. It costs $13,000 to $18,000 to raise a child in America, and a lot more, as we all know, in California. The number one reason people seek abortion care is because they know they can't afford to have a child. Many, about 60%, already have children. They know what the economic cost is, the physical cost, the mental and emotional cost, and they want to invest in the kids they already have. But these laws take away their agency to have the family that they want to have and that they can protect and hold dear. There was a UCSF study called the Turnaway Study, and it found that every woman who was denied access to abortion care, they went to get an abortion, they were denied their abortion, they are 4 times more likely to live in poverty, to have negative health outcomes, and for their children to continue to perpetuate intergenerational poverty. You have very little agency when you're poor, and so the relationship is strong. Now, I am not all doom and gloom, so I am going to switch over and tell you some good news, what gives me hope. My hope is looking, and one of them you'll feel weird about at first, but in the last 2 years since the Dobbs decision that overturned Roe versus Wade, there have been 7 ballot initiatives to protect and codify in state constitutions the right to choose. And they weren't all here in California, although we did it too. They were in states like Ohio. They were in states like Tennessee and Kentucky, where nobody thought we would win. But I've always known America is a pro-choice state. We're not in a pro-abortion country, we're a pro-choice, which means when most people walk into that ballot box and they have the choice to overturn or make abortion illegal, they choose not to. They like restrictions, but they all know they don't want to take away the right, because I have talked to clinicians who are, you talked about the anti-choice people outside the clinic you went to. Well, sometimes those people outside protesting are inside accessing abortion care. And when they're asked politely and with grace, why are you here? The people always say, the women always say, oh, my situation is very unique. And they are told everybody's situation is very unique. So the ballot initiatives are demonstrating time and again where we are as a country, and it gives me great hope. The other thing that gives me great hope, and this will sound weird, so bear with me, is actually the overturning of Roe. Now, I don't like living in a country that took a constitutional right and made it unconstitutional. I don't like living in a country that thinks they can tell women and people who can become pregnant what to do with their bodies. But Roe should have been the floor, not the ceiling. When all the 17 years I spent working at NARAL, all the resources of the reproductive health and rights movement were to protect Roe. But Roe did not protect everyone. It protected you if you were predominantly white and well off enough to have the income and resources to access abortion care. You could get an abortion in this country. But if you were poor, if you were an immigrant, if you were a woman of color, it was exponentially harder. In fact, most would say they had no choice. They had no agency. Because we've heard the stories about the states that don't have abortion care at all, where somebody shows up for 1 week, once a month, and that's, if you don't get your appointment, you don't get it. So it is incredibly important that we not focus on just one issue, as we have done for so long. We have siloed so many issues, and we need to bring them all together, because reproductive justice is economic justice, as is criminal justice, as is mental health. They're all intertwined because the causes of poverty are many, but the solution is simple in many ways. The best way not to be poor in this country is to have more money. And so a lot of the work that I do right now is putting money back into the hands and pockets of people who need it. Last year, my organization helped 5.5 million low-income Californians. Those are people who make under $30,000 a year. Put about $7 billion back in their pockets just through tax credits. But then there are great paying jobs that they don't know about. There's job training programs they don't know about. So it's a continuous cycle. And one of the things that I think is really giving me a lot of hope is also the idea of universal basic income. When people are given just a few $100s a month, they are able to support their families. They are able to get better jobs. The statistics on the over 100 pilot projects in America today are all showing the same thing. People are making good decisions because they have the agency to make those decisions for themselves and their families. When you have no money, you cannot make those decisions for yourself because you don't have the resources to do it. So that gives me an enormous amount of hope that we are inching towards a country that is going to fundamentally rethink how we think about reproductive justice. Not as reproductive rights, but as your Reverend mentioned, as reproductive justice. It's intertwined. You don't have one without the other. So when my kids come downstairs and it's raining and stormy and they're wearing jeans and t-shirts, do I make them wear a jacket? I sure don't. They gotta learn for themselves and start to make good decisions. Thank you very much.